It's not recording. Is it recording now? Oh.
So I'm here with Mr. Rios, who has been here before. About 5 years ago, we did both his carpal tunnels, and we use a special technique that has, you can't even see an incision in his hand, but we use about a 1/4 inch incision and a special instrument along with high resolution ultrasound guidance. So we use this probe that allows me to see from the skin to the bones in super high resolution to go in and release the ligament here. And so we can release the ligament in the wrist, and people get their sensation back usually within 24 hours of the procedure. The incision is so tiny, there's no stitch, and we're often able to do both sides at the same time, and people get back to work in days instead of weeks or months like they used to. So you had both hands done?
Both hands done. I was not able even to button my shirt, and that was on Friday. On Monday I was teaching again.
On Monday you were teaching
Yes.
again. So
At university.
and so very often people can go back to a light job like that within days, but even heavier things, we have people go back in between 3 days and 7 days afterwards. I don't like people to lift over 15 pounds for a week, and we don't like people to soak it in water. You can get it wet in 2 days, but you can't soak, like rinse it in the shower, but you can't soak it in a tub or in pool water or the ocean or anything like that for at least 2 weeks, because the incision can soak open and bacteria can get in there. But otherwise, most people are back to doing everything they want to do within hours of the surgery. Really, you can eat, get dressed, take care of yourself. People even drive home after getting both hands done. They'll drive here and drive home, because when we do your carpal tunnel, we don't paralyze any of the small muscles in the hand. So you can still grip the steering wheel. It's just numb in the area where we anesthetize the median nerve, which goes to the thumb and these 3 fingers. And so it'll feel like you're wearing gloves when you're driving, but you can still grip the steering wheel. So I tell people to if they're worried about that, not to worry. And we've had people drive down here, we're in Florida, from South Carolina, New Jersey, and drive home right after the procedure, start their journey home, and they've been fine. So but if you have any reservations yourself, you should always bring somebody with you to drive you home. But it's a pretty straightforward procedure. We do it all under local anesthetic, so you don't have to go to sleep. People with needle phobias, we have some special techniques where we use some breathing exercises and short meditations to completely relax you, so you just barely feel the needle, and it almost feels like just a scratch, and then you'll feel a little more tingly feeling as we numb it up. We allow that to kick in. It takes about 30 minutes for the numbing medicine to take effect, and that's usually all the pain. Did you have much pain after surgery?
Not at all.
What did you take for pain afterwards?
You gave me some prescription.
Okay.
I forgot what it was, but I didn't feel any pain whatsoever.
Yeah, good. Okay. Usually we recommend Tylenol and Aleve together, 2 and 2 every 8 hours for the first 2 days. And we don't usually have to give any prescription medication at this time, because the incision's so tiny, people barely have any pain with it. So, and would you come back again for?
I came back.
Yeah.
I came back after 7 years.
Yeah, after 7 years.
Yes.
He has a different problem today. He has what we call CMC arthritis, or thumb joint arthritis. We're going to go ahead and give him an injection for that now. So what we do when we do this is we use ultrasound guidance, so we make sure we get it in exactly the right place. We've already done the diagnostic exam on his hand, and so I'm going to find the spot where he needs to get the injection and just mark it, so that we have a rough idea of where we're going with the medication. And then we're going to go ahead and clean it with alcohol, and then we've already got it drawn up here. And I'm going to go ahead and use my ultrasound probe. spot where we're going to be given this. Let's see, I'll flip it down. I'm going to lift up your hand, hold it up there. And then put your wrist so it just tilts down a little bit there. Okay. I'm going to feel just a little bit as it goes through the skin there. That's in the joint. Just now this has numbing medicine in it, which should take effect in just a minute.
Okay.
You guys hit flip, please.
I'm not feeling anything.
You may feel a little fullness and maybe a little pain right now. So the needle's in the joint. So I'm going to go ahead and fully inject this medication, and you'll feel sometimes a little expansion. There it goes.
Okay.
It's really hard to inject this into the joint because it's such a small joint. You see my hand kind of shaking a little bit as I'm doing it, as I'm putting pressure on it. So I'm just going to make sure I come completely out here. Okay, go ahead and hit the. There it is. That's the injection into your thumb joint. Now he was having a lot of pain at the joint before we gave the injection. Like I couldn't move it very much without pain. Now, just to make sure I got it in the right place, no more pain now, right? So there's local anesthetic that gets rid of the pain right away, and then steroid medication, which should take effect in a couple of days, and then gradually get better and better over the next 2 weeks. And usually that resolves the symptoms of this type of thumb joint arthritis. People get it, they have difficulty pinching and twisting caps off of jars and things like that. Is that what you were getting?
Yes, yes.
Yeah. So this should resolve that more likely than not, and it may go away and never come back again. Occasionally it comes back and we have to give another injection. And if it gets really bad, there's some procedures we do to fix it, but I'd say the majority of patients get relief with just an injection, especially, you know, if you're not doing manual labor or anything like that. So, all right, you did great.
Fantastic.
Thank you very much.
Thank you.
All right, thanks.